Hello, so this is just a quick video on the lifestyle choices in health assignment, just an explanation of what it involves. Here is outline some of the possible consequences of consuming an unhealthy diet. So think about the criteria outline. What does that mean? It means describe in a little bit of detail, not too much detail. What are the consequences of consuming an unhealthy diet? Tied into that is discuss the long-term effects of obesity or extreme weight loss on the human body. So discuss is around the same amount of detail. You don't have to go into too much detail. It doesn't necessarily ask you to evaluate, but to discuss something is to have a little bit of back and forth on that subject. So this is from the National Centre for Eating Disorders, a couple of long-term effects of extreme weight loss, depression, concentration levels, and then it explains it a little bit. So that's the sort of thing that you would do in your essay. Note that it says obesity or extreme weight loss, so do one or the other. You don't need to do both of them. Then evaluate the evidence that suggests that the overconsumption of some foods, e.g. sugar, butter, red meat, can lead to health issues. So just note that it says evaluate the evidence. So how good is the evidence? So you want to criticize the evidence, you want to praise the evidence, you want to look at genuine research studies wherever possible. So there's a lot of material on red meat. There's also a lot of material out there on sugar, maybe less so on butter, but generally fat. So what you will be doing is to discuss that evidence and to say how strong the evidence is. So I've just put a little bit on the screen here about red meat. So this is from the National Institutes of Health, that's what the NIH stands for, and it says past research has tied red meat to increased risks of diabetes, cardiovascular disease, certain cancers, and then it goes through a bit of the real evidence from research studies. So a guy called Frank Hu from the Harvard School of Public Health actually studied 37,000 people, and what evidence did they throw up? And obviously in the case of if you're studying 37,000 people and you find a particular thing, potentially the evidence then is quite strong because you've looked at a wide variety and range of people in a controlled study. So that's the sort of thing that I want you to do, not just what's bad and what's good about consuming too much sugar. Evaluate the evidence. How good is the evidence? What are the pros and cons of the evidence? Does the evidence convince you either way? Is related to exercise, so it's a leaflet. So describe the general benefits to health of regular moderate exercise. So really simple. Give a description of some of the general benefits of moderate exercise. You might want to start with a quick description of what moderate exercise is, and then I've just give a couple of examples there just to illustrate what sort of thing you'd be talking about. So lower blood pressure, improved cholesterol, give a bit of a description of that. Then research the benefits and health hazards associated with a specific type of exercise. So I've put a couple of examples about running, but it could be high impact weight training, it could be CrossFit, it could be anything that you're interested in, but the idea is that your leaflet will give the reader real evidence on the benefits and health hazards of that particular activity. Running and high impact weight training are quite good because there's probably a lot of stuff out there on those things. So yeah, running, it says your knees can be damaged. So we all know that, well, most of us know that if you run quite a lot, it could harm your knees. And another piece of evidence is from the Wall Street Journal, which says that if you run over about 30 miles a week, it can actually be negative for your heart. It can allow plaque to build up in your heart. So you might be thinking you're being really healthy, but not necessarily. To evaluate the public perception to the use of different types of drugs, including alcohol, nicotine, marijuana, cocaine. So public perception, just a quick note in case you don't know, what do the public think? Remember, evaluate as well. So what do the public say? Try and delve into that a little bit. We've done a study on a piece of research, on SurveyMonkey, so you can use that. You can also do some internet book research. What can you find about public perception? So that word evaluate, again, it doesn't necessarily mean the pros and cons. In this case, it means unpick the public perception a little bit. Okay, so for example, the public might say nicotine is less harmful than cocaine, but in some studies they might say it's more harmful, so then you're evaluating it. So this is from the Global Commission on Drugs, and it says, when considering the reasons why someone might take drugs, psychological and moral explanations generally prevail, primarily the assumption that the person is weak or immoral. So in other words, that piece of evidence is saying that the public perception is that people who take drugs are weak or immoral. It's not necessarily that that's true, it's just what the public think. A quick link here from the BMJ, the British Medical Journal. This also gives us a little bit of idea about what the public think about certain drugs in relation to each other. So wait for it to load. And this is about age and perception of drugs. So the results here of the illegal drugs, heroin, methamphetamine and cocaine were rated as the most harmful, and cannabis were rated as the least harmful. Alcohol and tobacco were also rated as less harmful. So that's what the public think. And this study is saying that essentially what the public think about drugs is wrong. It doesn't match up with actual scientific knowledge on the dangers and the harmfulness of drugs. And that also changes with age. So go back to the last one. So evaluate, we've just done that one. So for a named drug, describe the possible benefits, if any, and the health risks associated with short-term or long-term consumption. So I would suggest that you do cannabis because it's quite good. There's a lot of information on that, and there also are clear, if you look at the research, they seem to be clear health risks and health benefits. So we looked at, for example, the fact that cannabis consumption, particularly if you start young, is associated with psychosis and certain mental health issues, whereas there seems to be quite a lot of evidence for the benefits of cannabis consumption. For example, there is a drug that's prescribed on the NHS for treating MS. It's called Sativex. You might have seen in the news recently, there's been a lot of stories about people going over to various countries and trying to import medical cannabis to this country and having it taken off them at customs, and then having to fight to get it back for their children who they're using it to treat. We also watched that TED talk about the child who has a form of childhood epilepsy, and she was having hundreds of seizures every week, and the cannabis stopped her from getting those seizures. So that's the sort of thing that you'll need to be talking about. So just onto the grade descriptors. So grade descriptor 1, understanding of the subject. So just, you should be showing understanding of what you're talking about, describing it in detail, describing it correctly. There's a few notes there, relevant facts and knowledge like data, key concepts and studies that you're going to use to show your understanding. In this case, it's technically a science unit, so look at scientific studies on the dangers, for example, of red meat, on the dangers of certain types of diet and things like that. Application, this is key for every assignment. So in this case, you need to apply knowledge to the issues raised by the criteria. For example, when evaluating evidence on diet and the public perception of drugs, bring in reputable evidence such as your own research and controlled studies. For example, public perception, look at the British Social Attitudes Survey, because that is what that's about. That's about what do the public think of X, Y, and Z issue. Communication and presentation. So make sure your work is presented and communicated well. Make sure that it follows the format. So for example, a leaflet should have pictures and should have titles and be well presented. A PowerPoint should have pictures on it. An essay should have certain conventions as well. Just make sure that they follow. Make sure you proofread your work before you submit it for spelling and grammar mistakes. It really, really helps. And last but not least, I forgot to include this one, but last but not least is quality. What is the overall quality of your work? So as a whole package, how good is it in relation to the criteria and to the assignment brief? That's it.